Here we are. Welcome to London, guys. Welcome to London. The most fun part is the vascular quiz. Can I ask you all to move here? So we're going to do the vascular quiz with Kym McNicholas, and it's something nice, something quick, and something fun. So everyone moves here. So don't be spread. Come to the first rows, please. Come. So Kym McNicholas is going to present the vascular quiz this year, and so let's start with the slides. It's nice questions with probably even most nice answers. So Kym we've been in contact since 2008. Please introduce yourself, Kym. So essentially you can. Do you want me to advance the slides?
Yeah. Okay. Do you mind? Hi, I'm Kym McNicholas. I don't know if you've heard of The Way to My Heart. We are the largest advocacy organization for PAD patients in the world. We are now officially no longer simply The Way to My Heart. We are now evolving into the Global PAD Association. We provide comprehensive, personalized education for more than 12,000 patients around the world, just about every country represented. We provide high-touch advocacy, preparing patients for their appointments so they don't talk about the flu when they were 15 years old, supporting them during appointments. We show up via phone, we'll show up via FaceTime or WhatsApp, whatever it might be, to take notes and to help facilitate a productive and satisfying conversation between the patient and the doctor. And then we follow up with the patient and their family, friends, whomever they choose, following that appointment to make sure they do have a comprehensive understanding of their diagnosis, their treatment options, and then we help them to develop a strategy for long-term management of the disease. And even more, we support these patients with lifestyle modifications. We have programs for walking, which are free to doctors, free to patients. We have a diet program and we have a smoking cessation program. And it's exciting because we have some great advisors who have been in the room over the past couple of days. Our senior advisor, of course, the senior physician advisor is Lorenzo, and he's been supporting us from the very beginning and would love to have any one of you involved to help volunteer or be an advisor. So excited about that. Okay, should we get started?
Exactly.
Okay.
So every question, raise your flag. I mean, you know how it works. After 2 days, if you don't know, you're a bit dumb, so you don't even deserve to be here. And actually, if your answer is right, so everyone stands up. You know, you've been sitting all day, at least you, me not. If your answer is right, you stand still. If your answer is wrong, you sit down. So, yep. I mean, everyone stands up, of course, you know, please. And, you know, if it's wrong, you're gonna get this kind of Pablo Escobar bad look. Okay, so of course a little bit of
a little bit of a warm-up. I think in the beginning.
Let's go.
A little bit of calisthenics. Okay, I haven't heard that word in a long time, calisthenics. Okay, so here we go. We did a poll of 80 patients in our network, and we asked the question, what is the number one thing patients say that doctors do not understand about PAD? I want you to treat me sooner with advanced methods. I wish you would spend more time explaining diagnostic and treatment options, or that I can't walk if I'm in pain. Now we're talking about the number one answer. What do you guys think?
I would say like it's how you want the world. How you want the world? You want a yellow world, or you want a yellow world? No, you don't want a yellow world. You want a green world. Am I right? Yeah. So. Yeah, I would say I see many green flags. Am I right? Okay, no, it's green. Okay, wait. It
is green. So 58% of the patients actually said that they wish that they did not have to go to Dr. Google, which scares the hell out of them, and tells them that they're going to be dead in 5 years. So wait a second.
This was a warm-up, okay?
Yes, just a warm-up. Oh, yeah, stand up.
I would say it's a warm-up. But guys, be smart, okay? Be smart. I'm helping you, you know, for once. So I'm not trying to make things more difficult. So
I think that's the toughest question.
Yeah, I know. But guys, you know, if I say green, flag the green, yeah? Okay. Okay. So this is what it looks like, you know.
Yeah, I mean, they were all top answers, but that was just number one. But
okay. Now, are you ready?
Ready? You got the rules, you got the flags, ready? We're all set to go.
Okay. So let's talk about the pioneers.
Yep. Who is the man in the picture? Is it Jack Nicholson? Is it Charles' daughter? Or is it Michael Lichtenberg? Come on, okay, good. We have a consensus.
Well done. Okay, we start easy, of course.
Okay, the first endo case, right? Okay. Good job. Okay, what did he use to treat that SFA? Was it angioplasty balloon? Was it the shockwave? Was it catheters of increasing sizes? We should have a consensus here too, and we do.
Yes,
wait, okay.
There are lots of yellow.
Yes.
Yeah. I see yellow. I think Martha, you were using the yellow. Yes, yellow catheters of increasing size. Yes, essentially, it was this. In which year?
And in which year did he perform the procedure? Anyone know offhand? 1936, 1964, or 1982?
Oh, oof. Thank you, guys.
Yeah.
I thought this was tough. 1961. When I did it, I said, okay, let's put the date very spread, Like, okay.
It was actually
64. So happy birthday, 60s. Okay, so this year is the 60th birthday. And this was the lady. Of course, many knew this picture. This was a report, is reports, 1966. Of course, it was the 16th of January of 64. These were the catheters were advanced through this guide wire inside, and actually, I love it. This was one of the requests that Charles' doctor received, and you can see very well that his vascular surgeon loved him, like probably mine loves me. Visualize, but do not try to fix, Crucified, yeah, exactly. So
who is this man? Anyone recognize him? Andreas Grunsig, Clark Gable, or Bradley Cooper?
Okay, good.
I'm glad everyone knows who he is. That's perfect. So in which year did he perform the angioplasty? 1946, 1994, or 1974?
1974, guys, and actually it's amazing because it was 10 years after the first passage of catheter. So it's very impressive. Okay, so this is of course the report. I don't even read it, but it was 1974 anyway, and he said everything was patent, and also at 1 year. No DCB, no scaffolding. The artery apparently was patent. Okay, happy 50th birthday because we're the 60th and now it's the 50th. It was used to create these balloons on the kitchen table, he says, with his wife. So they were creating that, and this how all started.
So what were they doing? So Andreas Grutzig, Gary Rubin, and Hal Whitworth, putting him to bed in an angio suite.
In order to be ready for the day after, long days.
Doing a coronary angiogram on him, or trying the first closure device on him.
Some people from last year. Good. This was a question.
We told you these are pretty easy.
Do we have coronary angiogram on him? Why? Tell us why.
Well, he wanted to be the first one and make sure to prove that they could send the person home all day. And he actually went to work right afterwards, and he had his hand in his pocket to put pressure on the access point. And then he went to the Christmas party later that night.
So he did it on that precise day. He said, I want to do it so I can go to the Christmas party and show off that they punctured me and I don't have to stay in bed for hours. So essentially, that's a funny story. There's a video of the fellow who said, because it was completely unexpected. The guy goes to the fellow and says, I want you to do an angiogram on me. Big chief saying, do an angiogram on me. And the fellow at the beginning thought he was joking, but actually no, it was pretty serious, and he did it. And everything went well. Luckily for the fellow, no pressure on the fellow, yeah? Anyway, next question.
Who is Julio Palmez known, what is he known for pioneering? Shh. Atherectomy, stent, or closure devices?
Good. Closure devices. Right?
Good job. And he actually used scraps of metal on his garage floor to create the first prototype. So that was kind of cool. Who is spoiling the next question?
I thought a wife.
So how is he spending his retirement? Skydiving, resting on a sofa, or winemaking?
Yeah. Okay.
No,
that's great.
Thanks,
that's great.
But you know what? He actually makes grape juice for the kids, and he makes olive oil. So he does all of the above.
Made it quite obvious. So essentially, winemaking.
Yeah, exactly.
Good. Very good.
Good job. Okay, so Joseph Frederick Benoit Charrier, did I pronounce that right? His surname was used as a measuring unit for the outer diameter and the general size catheters for various purposes. This unit is mostly called a gauge, French, or inch.
Very good. 8 French Rotarex, 6 French Rotarex. We learned it in the last. So it's a French. Actually, it was even Swiss. But he created this kind of acronym which was not very easy to say. Or say, let's call it French. It's easier to say. And essentially, it got adopted and since now. Okay, so people pray for the French people. Now, that was easier.
I know, you guys have done really well.
Then the next questions, it's a good warm-up. But now we're going to go to something more tough. And someone will be properly kicked out from the game. Okay, only one will remain.
Okay, Charles Thomas Stent, who was he? Was he a mechanical engineer? Was he a general surgeon? Or was he a dentist?
Yeah.
Oh, yeah, we're getting some dentists. He was actually...
he was a dentist.
He was a dentist.
He was a
English
dentist. Actually, he created this first composite material for implants, and then it moved to this kind of metal. It went down to taking the name also for the stents in the leg. And actually, I also need to remember you that also the barbers were both barbers, surgeons, and dentists. So essentially now, this is why we call in England the surgeons Mr. Because Mr. means that you have a qualification which in the ancient time was not even a doctor. Now the people are very proud of this Mr. But it was very bad way to call them in the ancient times. Yeah, I know, yeah, but it's like, I just put in hoping he was here. So, talking about surgeons.
Okay, so the surgeon is Robert Linston. During the period between 1835 and 1840, he performed 66 amputations. His mortality rate was equal to 74%, 15%, or 300%. Really understand the question.
It's total amount rate, total rate of amputation. Now let's have a look. 15% only. 300%. Oh, how many people? Wait. How many people?
I know.
How many people are still standing?
I think we only had one.
Okay. Second chance to everyone. Come up. Everyone back in the game. I know. Wait a second. No, let's do that. How many people are still there? How many people were there? You and?
Yeah, we had.
And you? 3. Okay, let's go down to 1, and then the next one will be at the second round. So please, the 3 here. Come here. And then we're gonna, a few more questions, we're gonna do the second grand. You already won a grand this morning. I like it, man. You want to take everything, really. I will never invite you at mine. Huh?
So anyway, it was 15%.
The 300% is because in one single intervention, the legend said, he was performing this amputation, he was showing off, like all the British people, and he was trying to do as soon as possible, of course, because also there's no general anesthesia. So essentially, the patient died because of the operation. The collaborator also died because he cut his finger. He died of gangrene, and the history says that also a man which was in the crowd died. So it's the only intervention with 300% amputation rate.
He was the fastest amputator in the UK.
Yeah, exactly.
So when was the very first amputation performed? Paleolithic age, medieval times, or 18th century?
Oh, 3 different questions, and we have the first winner then is Paleolithic age.
31,000
well done.
years
What's your name?
ago
What's your name?
On a child hunter-gatherer.
Boyan from Switzerland. Okay, very good. You want to tell the story?
Yeah, it was 31,000 years ago. It was a child hunter-gatherer, and they didn't say exactly why he needed his leg amputated, but he did survive for years. It actually healed, and he went on to just live his life for several more years, and so. Yeah.
And the fantastic thing is all the historians are extremely pleased by this kind of data because they thought that it was never possible for a human being at that time to survive in such an environment with one leg. So essentially also is a story of a community taking care of the single person like animals sometimes do, because I mean it was very difficult for him, of course, to survive this. So now everyone is back in the game, so everyone stands up again. Yeah, published, of course. They were like in stone, yeah. So.
Okay, the wall stent, why is it historically so important? Is it because it was the first coronary stent implanted ever? It was implanted in the iliac artery of Ronald Reagan in 1982? Or the first one implanted was made of interwoven guitar D strings? Oh wow, we still have a few different ones.
No, like I would go more towards the warm colors, the very reddish color, yeah. So, yeah, it was the first coronary stent implanted ever, incredibly. And there's a huge dispute between these two clinicians, Jacques Puyel and Ulrich from Switzerland. And actually, Jacques Puyel put it on a Sunday in a patient, knowing that this guy already planned an intervention the week after. So essentially, this guy, of course, was very pissed. He wrote this paper instead. If you want to read it, it's fantastic. It's like blaming on the other one to be correct because they didn't have the right protocol. That he knew that he was implanting, so he did it himself. But it was a wall stent. So the wall stent was the first stent implanted in a coronary. Well done, red flags. Now.
The first two sheeps where the wall stent was implanted, they died because of A, acute thrombosis of the stent, post-implantation bleeding, or loneliness.
Now, go in your mind, I'm telling you only this thing, go for the one you don't think it could be possible.
Which flag? Okay. Yeah.
Yellow, exactly. Loneliness. Like guys,
if you know sheep have a herd mentality and they have to be around other sheep. And so even though the stents remained patent after 10 days, the sheep just didn't make it.
So incredible, but it is like when they start putting it all together, it's that the sheep survived. Okay? We're almost done.
Okay, King Charles was born in 1948. What else was officially described on this same year?
There's someone who should know that, but she's sitting because this morning we said...
Sanger technique, femoral popliteal bypass, digital subtraction angiography.
Again, this guy won already this morning with this question. Yes, it's green. Femoral popliteal bypass. Okay, let's go here. So this is the pontage, because it was done by Coulen, who was one of the fellows of Le Riche. And actually, he got his boss very pissed because his boss went away for some teaching around. And he was very, very angry when he knew that he did something like that. So in the article, he says, I need to thank my boss because he supported me all the way. All this kind of bullshit, because like he needed to please the boss, but actually it was completely the opposite. Okay, well done. Now.
Intermittent claudication was first described in 1831 in what? A Nepalese Sherpa, Rutherford's granddad, or a horse?
Again, think about, no, not probably, I don't know, I would put the second less likely. Let's see what you can think.
Nah.
Yeah, a horse. Well done, guys. Well done, yellow flaggers. Well done. So essentially, yeah, they found out that this horse was not really claudicating well. He had, of course, a thrombus, and they found out it was a veterinary. So,
first retrograde pedal access was performed open, endo, or remotely?
Let's say not like it was done. It would have been done today.
Yeah.
Yes, I see the red open flags. Very good, very good, very good. Now, Vish, Patricia, the winner of this morning, I don't remember your name, and Thomas, come here. Because we come into the last stage again. Come here on the front, or on the stage, even better, on the stage, on the stage. I'm gonna try to help you, okay, to get you to the last bit, okay?
So I love that.
No, sorry, no, you can't see. So on the stage, but there. On the stage, but there. No, on the stage, but there, in the corner. Okay?
So I love this story because this was in the year 1271, and it was during the medieval times, and there was a 20-year-old cobbler and he ended up getting some calf pain. He had a lot of swelling. It started radiating, and they couldn't figure out what to do for him. So they said there's nothing we could do. So he goes to the King St. Louis's tomb, and he prays and prays and prays, and still nothing. So he's about to leave. What do you think at that point was hailed as the miracle cure for the first reported case compatible with a DVT? King St. Louis's wine, tomb dust, or amputation?
I doubt you guys. It's like...
I would say least likely, but they're all kind of, well, except for one.
No, change it, please, change it. Tom Dust.
It was tomb dust, putting it on the ulcer. He got a leg ulcer. I probably should have mentioned that.
Well done, green flaggers. Now.
What was the first isolated anticoagulant derived from in 1884? Leech saliva, petroleum ether extract, extracts of porcine heart. Yeah.
Yeah.
Ready?
You're out. Okay. Okay, so leave the stage. Leech saliva. Very well done, guys. Very well done.
Good job. And you know what's really sad is these are actually, and the only reason I knew, they actually sell leeches, dried leeches, and patients think that that can actually make a difference. And they're selling leech extract in capsules that, I'm not kidding, patients do believe and buy. So anyway, next.
Now, that's the last one, guys. That's a shooting, okay? The first one who raises the flag and gives the right answer will win. I mean, Thomas, you are much more, I would say. I'm so proud that two of my team, like my best radiographer, one of my best nurses definitely, are here with me on the stage. But this is a bit difficult for you. So let's see who's going to win. But you know, you have seen, I mentioned this case before. I said, once in my life I had this.
Which pathology does make the patient claudicating?
MRI. So let's try to discuss. You see there's an occlusion there. The white is the liquid. It's not atherosclerosis. This is a young patient. Sorry?
So answer or flag or what?
Answer.
Answer.
So
Adventitial cystic disease. Very good, very good.
Good job.
Well done, Thomas. So he's the second winner. So you are going to get a grant for some of your students. So congratulations to you. And actually, this is the close of this event. Of course, we are very few here still, but I want to congratulate all of you for making this event, for me at least, memorable. Thanks a lot for staying, and hopefully see you next year in 2025. Thanks a lot.